Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well. I want to showcase this patient mostly for his anti-aging results. He was also concerned about his scars. He sometimes comes on here, and he's been a long-term, a long-standing viewer. And so this was after a single session at this point, right over here for this first photo. And then when he came in April, I ended up doing more TCA and Bellafill for him. But you could see actually just significant improvement of his skin quality after that first session. So it's a really, really cool progress right over here over the course of about 6 months for this patient. This is again a patient who wanted things to just rejuvenate his skin, was worried about some of the scars. He's somebody who has an otherwise active lifestyle, works out a lot, and tries to stay really healthy, but just thought that his scars were just holding him back. You know, he just felt like his scars were just not letting him really go and be as social as he wants to be, and he felt that it just was like just not himself when he was looking at himself. And when he'd go out with friends or so, he thought that maybe they were looking at his scars, or maybe they were looking at his texture, or thought that he looked older than he was supposed to look. And it really upset him. It really bothered him. You know, he felt that this was something that wasn't a problem during when he was growing up, and up until the point of him having acne, everything was going fine until he started getting some really severe cystic acne. Akita is saying, hi, do you think 16% azelaic acid is effective for moderate hyperpigmentation that's blotchy? Yeah, maybe a little bit too strong still. Maybe you could go just to 10% on the body. I usually don't go too strong on the body with azelaic acid or any exfoliant. So it's possible that it may need to go a little bit less. But yeah, this is, I do a lot with anti-aging as well. And azelaic acid can work very, very well. Even in patients who are pregnant, we could place them on azelaic acid, and it helps just as like a mild exfoliant, helps for acne-prone skin. So it's a really, really good product. Helps for some redness as well. So a few different things that actually works really nicely for it. Let's see here. Oh, Akaida is saying for their face, then yes, you could do that for your face. Titi Marie is saying, oh, hi, Titi Marie. How's it going? Hi, Lucky Singh. How's it going with you? But yeah, this is a patient mostly, he wants it for anti-aging purposes. He wanted that. He was concerned about some of his scars after a single session for this patient. Actually, I'm going to put that on the screen over here. Single session results over here. So this is 6 months out after a single session. And yeah, it's pretty cool. I mean, it's obviously he wasn't having like severe case or anything like that. But in his mind, it was really problematic, and it was something that he felt that was really holding him back. So this is something, I would put this in there, single session acne scar result. And also for anti-aging purposes though, so like just to overall make your skin just look like it's more youthful. Sometimes actually the big thing is that with scars is that people that have scars notice that it does make them feel a little bit older. And that's something that a lot of people will say that, it's makes them feel like they just weren't themselves. They didn't age the way they really should have aged. Sometimes people feel like they had a more youthful look before at one point, and then because of their scars, they weren't able to achieve that. And, this particular patient, he's there. Hi, Dr. Rizwan. Good seeing you on. Dr. Rizwan had a whole great press conference. I saw that, actually. Thanks for coming on. At some point, I should have you on there. He had a great press conference. He was actually a physician all the way from Canada, and he went over to Gaza to volunteer. He went there, I think, a couple of times, right? Saw horrific stuff over there. And, I've been following his page, and it's interesting. He's good to see you on right now. And he had a big press conference like a couple of days ago, really just documenting all the different things that the horrors that he saw. Interestingly enough, they didn't really talk to him for so long, and finally now they're starting to talk to people. And I guess it's getting really hard to cover up what's happening there now. 19 months into this, it's getting really tough for people to cover it up. Let's see here. Do you hire nurses? Yeah, we do. You could apply over to our, you could go through our hr@qaziclinic.com. Send it over there. We right now are currently full, but we do have some per diems that you could take a look and see. Just apply that way. Andrea is saying, what's your opinion on subcision for acne scars? I had to do subcision from this patient, actually. You can't appreciate it completely in this photo, but when he animates and he smiles, it was really, there was areas where it was pulled down, it was stuck, and we had to go in there and break up that scar tissue along the temple area. I had to do that along the jaw area, and even in the cheek area. We had to actually do subcision in this case. So it was actually important for him because that's how I was able to lay the Bellafill in the right pocket there. And he's somebody who did some other treatments before in the past. Nothing really seemed to work, and we already see a really, really great improvement over here. So this is 6 months out after a single session for this patient. Of course, and he comes on here sometimes, but I'm not sure if he's on tonight. But everybody's viewpoint of their scars is a little bit different. They may think that, it's slow. It is slow. Sometimes it ends up happening. It could take 6 months to a year, and that's just like how it is, because your collagen could take a long time to redevelop, and we were able to get that over here. Thank you so much, Mrs. Jones, saying it's a beautiful result. Appreciate you so much, Mrs. Jones, for that. And you can see that's just he looks a lot more youthful as well, which is really cool. You got to trust the process. Exactly, Mrs. Jones. Thank you so much. Thank you for saying my words there. Zeke is saying, I just bought a Neutrogena cream for acne spots and scars. Do you think it could help? What's in there? What's in the thing that's in there? Gab is saying, do you recommend anyone in Chicago that does similar work? I grew up in Chicago. That's where I'm from. And I have a lot of patients from Chicago. And it turns out that there hasn't been many differences in what I, dealt with when I was doing acne scars way back in in the early 2000s. I was getting treatments done. And in the 90s, I was getting things done with dermatologists as well. And just it sounds like just things haven't really changed or evolved over there. So unfortunately, Gab, there's just not many of us really, unfortunately. But that's why I take this so seriously, and I want to make sure that we just hit this at a very, very high level. My patient today, she was reporting to me that she had done microneedling and with PRP, and she has such severe deep scars, really severe deep scars, and it was just like this, like there's sadness in her with that, just that she was essentially kind of what she felt like was just like, forced to purchase all these packages. And she was told that essentially what she was basically told was that it was her fault that she didn't develop the collagen response or anything like that. And the truth is that it just wasn't the right treatments, though. These treatments for deep boxcar scars and ice pick scars, it needs to be really customized with TCA Cross or Excision, things like that. Someone was asking me how we customize that with the TCA, and really it depends on your skin type. That's what a lot of it matters, like with your skin type, what your Fitzpatrick is, and then it also depends on the location of the scars. It depends on the depth of the scars. So there's a lot involved. The type of scars, of course, if it's a wider scar, if it's a deeper scar, wide, deep, there's a few different things that are involved with TCA. A lot of things, actually. That's why I would say that it's actually one of the most difficult things to actually do correctly. And it's shocking to me that sometimes people do it actually at home or so, because it's just like it's so difficult to do correctly. I do so much of it, and I wouldn't do it on my own face, So I'm shocked sometimes that people are trying to purchase it and do it. I understand they don't have access to it sometimes, but it can really cause catastrophic problems. I've had that, with patients who have gotten it done elsewhere, even professionals, and they've gotten really badly burned, or they've done it themselves and they got badly burned, and it's really difficult to improve it. I got to improve it, but it can be difficult. What about hyperpigmentation after CO2 laser? Danit is asking about hyperpigmentation after CO2 laser. So that's really typically post-inflammatory hyperpigmentation. Sometimes it's due to sun exposure. Sometimes it's due to the laser itself, the heat itself. You should have prepped your skin first beforehand. If you weren't able to do that, or the person that did the laser on you didn't tell you to do that, then you could ask them to try to put you on something that's like a skin lightener, something that actually could work pretty well as hydroquinone or Triluma cream. Triluma could work well. Actually, my dog just grabbed something in her mouth. Somebody just grabbed that from her. So I had to save that situation there. Sometimes you don't. It's never a good thing when you can't hear them for a little bit of time. It's like with kids too. If you can't hear them for a little bit, it's like, what are they up to right now? TT is saying, I'm struggling leaving the house with is because of these scars. When the UV is 5, I'm in the UK. Yeah, I use these visors. I'm in sunny California, so it's really really sunny for us, and I want to make sure that I stay like the same complexion all the time, or as much as I could. And so I use like a visor when I go outside. It works out really well. A UV visor, plus of course you want to use a ton of sunblock. Thank you so much, Lucky Singh. Thank you so much. But yeah, where was it at here? Where are we located? We're at Newport Beach, California. Newport Beach, California. We are just a few minutes away from the airport right here. Is it true that 2.5% benzoyl peroxide helps with indented scars? It's a good question. I think that there's some things that really just because it could help with oil production, and that potentially does end up helping a bit with the scarring. As you reduce the oil, you see that the scar diameter reduces a bit there as well. I'm just not a big fan of benzoyl peroxide. I didn't love it myself when I had acne. I thought it was really overly drying. There's a lot of evidence now that benzene is carcinogenic as well. There's a lot of benzoyl peroxide products that were pulled off the market. Certainly in small doses is probably going to be fine. It's okay. But there's a lot of better options. You could do just topical retinoids are going to be great, really, really great options. And then for like the antimicrobial effect, you could be on like clindamycin for a few months, or something that's just going to be like just to kill some of that surface bacteria. You could do like a sulfur-based cream like Dapsone. Dapsone works really, really well. User is asking, how much does a consultation cost? Can I book for a consult and get treatment Subcision the same day? No, you can't do it the same day. Typically, we're very, really busy, so usually we have to schedule that out. But our consultation fees are $150. They go towards the procedure. So just so you're aware that they actually just go towards the procedure there, and you can just schedule it just directly on our page. We have our prices on there. I did that on purpose. I really wanted to make sure that things were just like really clear for people. There's a lot of aspects of this that's just like very confusing. Actually, I ran into one of my patients today, a really, really nice gentleman all the way from New Jersey. He said he sometimes comes on here, and he was saying that he wants to start a fund at some point, someday. But that was an interesting thing, like, just to see, because he said there was just so much suffering involved with acne and scars, and he did well with his life. And so one day, not anytime soon, but he's saying one day maybe he will do something like that. And it's interesting, how so many people that suffer from this at some point in their life, and they're in this journey now where it's getting better, or like they're at a place in their life where it's they know where they were, and they know how it held them back, and they want to give back to the community. Or just give back to the world. And that's how I feel with things. It's like, it's pretty cool. It's a pretty cool feeling. And a lot of people that are in the scar world, they also feel the same way. They also feel the same way that like the patients that I have over and over and over again, they're open to like sharing results. Like this patient right here, open to sharing results. And it's like, just because like they know that like they had done a bunch of nonsense stuff before. And I mean that like they themselves say that sometimes. It was like a bunch of nonsense treatments, and they want to have something to showcase to other people that, hey, there's a way to do this differently. There's a way to do this in a better way. Get a little bit more hope out there, because they know what it feels like. They know what it's like actually just to have like just no hope out there, and feel like you just couldn't get the skin that you wanted, couldn't get the look that you were trying to achieve. And all because you had acne when you were a teenager, and it's really, really frustrating for people. Yeah, it was really, really a tough thing. Really, really tough thing for a lot of people, that they suffer from the acne portion of things, and they have the scars later on. And it's like a patient's that potentially look like this patient, who say that they have trouble with dates then, because they say that sometimes it's like they go out on a date, and even though they may not look like bad scarring to you and me or anyone else, sometimes they do feel like their date is actually looking at their scars. And it's possible, I think people do feel that. They do recognize where someone's looking, their eyes are shifting right there. And, they say sometimes that like with certain lighting, they notice that. And it could be debilitating for people. It could be debilitating for their confidence. It could be making it so that they were a certain, certainly they could have had like another pathway with their social life, with like finding a partner. And then this is something that just in their back of their mind was holding them back a bit there. And it's tough then for people. Let's see here. Hakeem is saying, good evening, doc. What treatment do you recommend for acne scarring on dark skin Nigerian ethnicity? So sometimes we don't use, good to see you, by the way, Hakeem the Dream. I love Hakeem Olajuwon, who's awesome. But Hakeem is asking about acne scarring on dark skin Nigerian ethnicity. So that usually requires a few different modalities that aren't with energy devices unless it's really necessary. Typically what we do is we undermine the skin with subcision. We do TCA Cross still, and a lot of times we do volume replacement. If we do need some laser, I use lower heat energy devices like erbium laser, and sometimes some spot treatments with potentially a CO2 laser as well, sometimes. Raiko Flama is saying, I'm saving right now. I'm going to go to you. Appreciate you. I have trust you'll know what to do. My acne scars are not as bad or deep, so I know you got something for it. Well, appreciate you, Raiko Flama. I will take it very seriously and take care of you. Cookie John is saying, hi doc, does isotretinoin make pitted acne scars look worse during treatment? If so, do they go back to normal after the course? It's not exactly that it will go worse unless you're really, really dry and your body's still trying to produce oil production, produce a little bit of oil, then it can look a little bit worse at that point is the things that I would normally see with that. But you got to control the dose. Potentially the dose is not correct. You got to make sure you're not using other exfoliants. Potentially that's what's happening, and really go down the list there. And you may need a lot more with sunblock and making sure that you're using a lot more moisturizer. TT Marie is saying, is it possible to get a 3rd-degree sunburn, and is it the same as a chemical burn? No, it's not exactly the same as a chemical burn. A 3rd-degree full, I would say that that's going to be extremely rare to get. Really, really rare to get a full thickness burn there from sun exposure, because typically you should have a lot of pain if you're out there in the sun. But certainly it's possible if you have a lot of blistering and it's it's scabbed off, and then you've got some more burn, further burn there. Now it gets a deeper level. Then theoretically it's possible. It's just extremely unusual to get that, though. I would say it's really difficult. How much would treatments cost? I will travel from New York to you for treatment. I appreciate you, Hakeem. The treatment prices, most patients spend about $5,000 to $7,000 on their scars. It just depends on how much volume replacement we have to do. Some patients, like this particular patient, for example, did require more volume to be able to get this, and that means things like Bellafill, for example, and that could be pricier. So that's typically what ends up happening. Brooke is saying, I noticed they look much worse anytime I introduce a retinol or chemical exfoliant, and it's possible that it's just overly drying your skin, and then what ends up happening is that your body tries to produce a little bit of oil to overcompensate for that. So the things to do is pay attention to when you're, first of all, just be careful not to overly exfoliate your skin, and then moisturize and sunblock. There's a ton of that, and you should see that it gets a lot better then. User is saying, are subcision results permanent, or do you need a touch-up, or does it vary case by case? It's permanent. I mean, it's there. We broke up that scar tissue and it's gone. And unless you have new acne or we didn't do a complete subcision and completely break up that scar tissue, it really should be just like it's done. It really should be that we don't have to worry. I've had patients for 8 years ago that I've done, and it still looks awesome and smooth, and it's really, really great, and I don't have to worry about it, and we never have to touch it again. So sometimes, if we didn't do a complete subcision, then, or if there's something that was an area that potentially was too deep or whatever else, sometimes below the zygomatic arch, it may be a little bit of risk to go really aggressive there. So we may not go as deep or aggressive there, and possibly we have to repeat that. But that's not because the subcision didn't last. Let's see here. Where was I at here? TT is asking, sorry for asking. I'm really struggling going outside. It's affected me very much. It's nice to hear that it's very rare. I might be able to get some SPF 50 and try to go and see my friends. It sounds like you have very high sun sensitivity. You actually should double check also to see if some people actually have an allergy to the sun. I'm not sure if that's your case, but you actually may want to double check to see with the dermatologist to see if that's the case. And you have to get UV sensitivity, just constantly go to the dermatologist and potentially just get that done. I'm not sure exactly, because it sounds like you're saying that you're getting severe burns from there, and maybe there's something else that's going on there. Let's see here. Where was I at there? Do you prefer dissolvable or non-dissolvable stitches for punch excisions? It's I don't run into too many problems with excisions because sometimes with 1 millimeter, you don't actually have to do stitches because actually it could cause a little bit more tension than you may want. 2 to 3 millimeter, yes, you do a lot of times want to do stitches. And typically, a lot of people will say that dissolvable ones will cause inflammation, but it's actually really low likelihood. So we want them to just have it easy. So go dissolve after about a week or so. Typically it's a dissolvable suture. So typically, that being said, if somebody has the ability to remove the stitches or they come to us to remove the stitches, then we can absolutely do non-dissolvable stitches as well. NBRID is saying, is CO2 laser the best for white stretch marks on light skin, not too deep, but 15 years old? That's a good option, actually. CO2 laser could potentially trigger melanocytes, which could then end up causing you to get your pigmentation back. So it's possible. Mrs. Jones saying, thank you for coming on the lives. Thank you so much for coming on too, Mrs. Jones. Appreciate you. Hi, Dr. Qazi. This is great results. Thank you so much, Resin. Appreciate you. This patient, he comes on here sometimes, and so he sometimes needs, he's somebody who's been on for like a couple of years actually, and really just wanted to get something where it improved and felt a lot more comfortable and confident in his skin. This is after just a single session for him. And so what we did for this patient, for Joanne is asking, or Io is asking, what do we do? We did Subcision, we did TCA Cross, we did CO2 laser, and we did Bellafill for this patient. So with Subcision means we went underneath the scar tissue, broke up the scars, did it all along the jawline too, and did a really, really excellent improvement actually for this patient because that jawline area to take a lot more work actually. It could be really tough actually to break up. And you can see that people say, well, Subcision cause sagging, things like that. The thing is, the reality is that before photo, that actually shows that there was sagging due to his scars. His scars actually were causing laxity because as he was smiling and animating, his skin was bending around his scars. And then it ends up actually causing this looseness there that can end up happening. So Subcision actually could prevent that from happening. It could prevent it from getting looser if you get it right. And again, these are not this is not a severe case, but he's somebody who comes on here, and I think it's worth showcasing to people that there is a way to get really, really excellent results, even in tricky areas along the jawline here. And the lighting is actually exactly the same. What it is that it's just that he's just looks like he's more uniform. There's less of the harshness that you could see because it's just more uniform right now. So it's exactly the same angle lighting that we use. And this is actually, that's all it is. There's we could zoom in on this completely. I'll make myself smaller and you can see, let's see if I can get them bigger. So what it is actually, it's the harshness of those spots is just so minimal right now. It's just really minimal. So that's why his skin tone looks great, more evened out. He's just more full overall. So you don't see that harshness as much anymore. And that's what you see visibly when you're looking at the patient and you're doing it under the angle lighting. Like my patient today, I've been working on her for a year and a half, and it's so flat there, and it used to be so deep. So it's just over time, it's supposed to get softer and softer. That's the whole point of this. Over time, we want this so that even with harshest lighting, it's not as visible and not as noticeable. It could take time. This is actually pretty fast actually for this patient. 6 months is pretty fast. Eric Callahan is saying, I had a completely smooth nose and most of it is still smooth, but I took out a couple sebum plugs, sebaceous filaments, and now they are pitted. How do I fix this? Usually you want to do TCA Cross. You also want to control your oil production a little bit more. So it's possible that you have to do something to control oil production and then do some TCA. That's probably what you have to do. And then you said potentially microneedling, CO2, BBL. Those are okay. CO2 laser is okay for the nose, and TCA Cross is great. BBL is not going to help much at all for that though. Microneedling is not going to help much at all for the nose. Let's see here. Prairies and Rockies is saying, hi, Dr. Qazi, can I do consultation and procedure on the same day? If I'm only booked for in-person consultation, can you do whatever procedure you recommend on the same day? Typically, no. So typically, we do not do it that way. If you would like to do it that way, please let the staff know so we could take a look and see. But usually, we would have to have that set up before we do the procedure itself. Let's see. Someone's saying they can't hear me. It seemed like people were able to hear me. unless something, I just hit something. Seems pretty fine to me. Let's see here. Oh, hi ZMR, how's it going? Good seeing you on, by the way. Thanks so much for coming on. Lucky Singh is saying, hi, Dr. Qazi, I'm seeing my GP tomorrow. He said the pain on my cheeks, maybe rosacea. What medication would help with that? Well, a lot of times you need some sort of topical antimicrobial, like essentially metronidazole could work well, or ivermectin. Ivermectin works really well for rosacea patients, so maybe something to consider. Okay, I appreciate it. Everybody says they could hear me. And good seeing you on, ZMR. Good seeing you on. Hopefully at some point we'll see you in person whenever you're ready to do that. I know you're far away, but one day it'll be. I saw your thing again. Someone tagged me again, I think, in there about one of your things that you're saying is you're still feeling like you're down about your skin, and of course, we're here to help, and we'll see how to do that for you. Alejandro saying, do you do FaceTime consults? Not FaceTime, we do it through, but we do virtual ones though. And just let us know. We'll schedule it over for you. Just do it through the online platform. ZMR, we'll take a look and see, especially if it was more recent. I know that before we had tried to meet up a couple times, but we'll try to see. Just email us and we'll see when we can set that up then for you. Let's see here. Hi, Dr. Qazi. What is the best treatment for rolling scars? Rolling scars, really, if you break up that scar tissue, go inside there, break it up with Subcision. That's really one of the best options there. And then plus a little bit of volume there. That's going to be probably the best options there. And yes, Yamara, perfect. Yeah, and don't feel down. Honestly, I actually, there was a case, someone mentioned you the other day, one of my patients, and her skin was actually very similar to yours. And, she's going to get a great result. And actually someone else that I worked on pretty recently too, she had also mentioned you and very similar skin. And it turns out that there's a lot of people with that suffer from the kind of scars you have, and we deal with it all the time. Actually, I showed you someone's result at kind of similar. I showed it last week. It's very similar skin as yours too. So it's very doable. It just could take like 1.5 years to 2 years sometimes. What's my opinion on phenol peel? So it's great for the right kind of scars. If it's the right kind of scars, it's really great. But it's a lot of downtime, a lot of recovery, and it may not be necessary because sometimes, we can still, like this patient, for example, we're still able to get an excellent result without that kind of downtime. And it's significantly better. We're still, this was after a single session when he came in April. I ended up doing a little bit of Bellafill for him, and then a little bit more TCA and some more laser, and he's going to get a better result. Like the next time we'll see a little bit better. ZMR is saying, I believe you will make me love my skin. Yeah, eventually, that'll be the goal. It'll be really, really, really great to actually have that for people, that eventually I want everybody to love what they see in the mirror. I really do. Whatever their issue is that they're seeing, obviously people, there's a thing where a lot of people say, well, there's just like the scar world and pigmentation, all this type of cosmetic type of stuff. They just assume all of this is really lumped into this area where it really is just due to body dysmorphia. And there could be a component of that. Like, I think that, of course, there's some people that it could get really excessive. It can become really problematic. But honestly, if you actually think about it and you talk to people, a lot of people have some sort of insecurity about something that they're looking at. And it's not that they're obsessed with it over and over. Hopefully, that otherwise it does get veer into a more severe case of body dysmorphia. But a lot of people, really a vast majority of people around you, will find that there's something that they look at and they think maybe I could optimize that a little bit better. If it's a point where though that you're looking at this and it's like everything else is going fine in your life and this particular aspect is holding you back and making it so that you can't really achieve what you want to achieve, there's a lot of people that are trying to be creators on here or do what I do and talk on these lives or talk there, and they have a lot of cool ideas, a lot of really, really great ideas and the businesses, and they want to do those things, and they feel that they can't do what they want to do for their career. They can't launch their business because their skin is holding them back. And it's tough, it's really, really tough for people like that. There's a lot of people that are they want to be more in front of the camera, even though it's, something that they may not do in their personal life, but they know for a business purpose or for getting clients in the door, it's really important to explain and show your face like that. And they look at themselves and they say that, I don't feel comfortable with it. I just don't like the way I look right now. I don't like it. And I don't feel confident in what I see right there. And it brings them down, and then they can't do it, and they can't present it the way they want to present it. They can't go and do these kind of things, and it's tough. I think it's really, really tough. I think it's a really, really tough thing for people, because it's like, man, imagine if like, we had patients that just like, or people out there that didn't have this didn't suffer like this. They could have probably achieved at an earlier point in their life some of their dreams that they're having, and like being more successful. And it's like, this was something that potentially held them back. So that's too bad. Marco is saying that he thinks that this person just needed to drink water. I don't know what to make of that, Marco. That reminds me to drink water. I'm about to wrap up for tonight and then for this week, but I'll hit a few other questions here. Let's see here. Where was I at? I noticed when I pull my skin up, the scars lessen. Would a mini facelift help? It may help a bit, but I've had patients who've done a mini facelift. It's actually best a lot of times to still break up the scar tissue, remodel the scar tissue, and then eventually consider doing something like that, like removing that skin. Ziomara is saying it's just a terrible feeling, especially when you look at yourself in the mirror. It's terrible that you feel that's just terrible, really. And that's the thing. It's like, if that's the thing that's holding you back, then absolutely, we should try to work on this so that people just feel more comfortable and confident. How long after a combinations treatment can you start working out? Just got my treatment done with you this week. Excited to see the results. Thank you for these live Q&As. I appreciate you, Patel. I appreciate you. Thank you so much for coming on. And after a combination session, usually 1 week later. And yes, and we were actually just talking. You were just talking about Ziomara over there. So there we go. Let's see here. I missed a few different things here. Yes, you understand completely, Dr. Qazi. And I do understand to a certain point, because it's like I did have, I did actually have like acne, which is really bad. My scar, unfortunately, it wasn't terrible, but it was enough that I felt like it held me back. But I do know that there's a lot of people who suffer a lot more. There's a lot of people who suffer a lot more. And it's like, amazing. It's an amazing feeling just to feel like I could actually just improve that in my little world and improve the trajectory that they're having in their lives. One of my patients today, she said that she's actually a speech therapist for autism kids for preschool age. And pretty interesting, actually, because she said that the whole journey for the whole year, she sees how they grow, and now they're graduating, and like she could see just that progress. And just imagine that at preschool level, somebody who was autistic, and they now shifted into being able to talk and be more comfortable and confident. Actually, I know somebody, a family friend of mine, his son was autistic, and up until pretty recently just wasn't even able to talk, but did do speech therapy and worked at it, and probably a few other things that ended up working very, very well. And now the confidence and like the ability to hold conversations is just like it's incredible to see, even though he's a very young kid, but it's amazing to see that. And like that whole trajectory in that person's life now has shifted and changed. So I mean, people always say, is it worth going to medicine? Honestly, for me, it's amazing, because like I get that feeling, or anything with like in this kind of healthcare world. You don't necessarily have to be in healthcare, I would say, but like there's a lot of things you could do in different fields that could do that. But it's something that I feel like you could do directly with people, that you could change somebody's way of actually looking at themselves in their life, and potentially just helping them out so that they have a whole different world, and like a much better world. And it's pretty cool. Very, very few things actually give that kind of satisfaction, I would say, honestly. Precious Wanderlust is saying it's hard for some of us who can't pay $20,000 for all these treatments. It doesn't have to cost $20,000, but it is expensive, but it doesn't have to cost that. We do accept almost all payment plans. Eventually someday I'll accept like crypto and all those sorts of stuff too, just to see, if that's something that people need to, someone was asking me the other day if I could accept crypto and all that. Sure. We'll try to accept everything. That's the thing. I just want to have it so that everything's just really easy and accessible for patients, and so they could do these things. It's really, really important for it to be. But I would say though that with these type of these kind of cases, it doesn't have to be $20,000. And whatever we're going to do when we do it, we'll do it in a way that's just going to just make sure that we could just like maximize results, really. So I'll just make sure that's just done really, really at a very, very high level for you. Can I get your expertise? I have burn scars. I love doing burns. I mean, sorry you have burn scars, but I do actually really like improving burns because it's something that I do recognize how debilitating it is. One of my, like when I was actually, before I did all this, I was actually going to go to burn surgery. It was actually one of the things I was actually thinking really, really strongly. Trauma, burn surgery. I actually did multiple rotations in the burn unit, one of the, like the top burn units in the country in Cook County Hospital in Chicago. One of the top actually, but really we saw really, really complex cases over there. And I also worked actually in Thailand in the burn center over there. So I did a lot with burns actually. It was like something that's one of the reasons why I think we could recover patients. People out in here are my patients here. And I get your skin recovered pretty fast. People are shocked by how fast we could get the skin recovered after we do these lasers. And a lot of it's because just how much I did with burns. And I want to make sure that we could do this very, very safely, and I'm doing these lasers very aggressively. So burns, I would love to be able to help you out with that. If people travel for treatments, how long do they need to stay in California? Do they need rest? You could leave the same day. A lot of our patients leave the same day. There's no problem with that, actually. It's absolutely no problem. Hi, what scar revision treatments would you recommend with darker skin patients? The thing is that it doesn't really matter. I could do all these different types of treatments. It just depends on the type of scars. But sometimes if it's really a matter of that where the texture is okay, then maybe more like physical manual type of treatments, like breaking up the scar tissue, doing that with Subcision, doing a little bit of TCA Cross, doing some volume. Those things actually work out really well. What's my favorite color? Probably blue. You can see the blue over here, blue in the background. Probably blue, I'd say. But actually, I like a lot of colors, to be honest with you. Alex Carter saying, I wanted to thank you, Dr. Qazi, for doing this. You are the only dermatologist that shares their knowledge to help people make a decision on how to go forward with treatment. I'm so thankful for your help. I appreciate you, Alex Carter. The thing is, and some people are asking right here about my expertise and like how I did all this. Someone, Lazy's asking, what inspired you to become a doctor? So there's a lot of different things, a long journey, and I'll go into it a little bit briefly. But it's the end of the night here, so I'll just kind of briefly go into this. But essentially, I wasn't going to go into medicine. My dad was a doctor, and I was thinking to myself that like I don't want to like do the predictable path that like everybody said just to do. Like a lot of family members were doctors, and I was like I was an international relations major in undergrad, trying to go into law school. Then I got into law school, worked at a law firm, and then right before I just like decided I'm not going to go to law school because I didn't like it at all. And I was just like, I do actually want to do things a certain way and a certain level, and do want to make an impact on people's lives. And my dad loves it. He just retired this year finally, and he loved medicine. And he's like, it's a great field, and it's like a wonderful way, and like he thought I'd be really, really good at it. So then I ended up going down that pathway in the medical world by doing a post-bac program actually. And that helped so I could then go into med school. So yeah, it was a long, long journey. And then ultimately, I was realizing when I was in med school that I liked a lot of different things, a lot of stuff. And there was a lot of aspects that I really enjoyed. And I really liked like the medical side of things, like in terms of like actually like the cerebral, like just diagnosing patients that are really complex, like in the ICU. And that's why I like the burn unit too, because it's very, very complex cases, like very, very complex. And I was like, this is kind of like my world, and I'll go into medicine, internal medicine. But then I really disliked the hospital system, like really, really disliked it. It was just a terrible system. I thought that it was just like going to destroy a lot of people, because a lot of people that go into medicine, because it's just like about like just discharging patients. It's about like just following along like this the standardized plan and whatever else. And they don't want you to talk to patients enough. They don't want you to do a lot of things because they just want to get people moving and just get the next body on the floor. And I was like, this is just not me. It's not my style. And that's why I ended up going towards the skin restoration route, because I knew that like I wasn't this was not done properly for myself. And it was not done on a high enough level. And I felt like in this country, it just was done pretty poorly overall. And there were a lot of people suffering from it. I suffer from it. I suffered a lot from it. I suffered a lot from the acne portion of things. Like it really was terrible for me in high school, really terrible. And I looked at it and I was like, there's just, looking at my scars, looking at my skin, that I did so many sessions of Fraxel and microneedling and thousands of dollars down the drain, that what would I do to solve this? And it turned out that it was a lot different than what, I was told to do. And so that's the short version of how I ended up doing this now. Do you do Taylor Liberator? Yeah, I do Taylor Liberator. I gotta double check if I did it on this patient. I don't believe I did. I think I mostly just did blunt candle. I do sometimes. So about a couple times a week or so I do it. But it depends. It's certain select areas. Love to hear your passion and backstory. It's inspirational. Thank you so much. Yeah, I think that we have that for a lot of people in a lot of different fields. And sometimes I ask people I understand some people are in certain fields that but if they weren't in that, maybe there'll be something else that they would really enjoy. What would it be? And it's interesting to see, it's interesting what kind of where people will end up going, and and maybe at some point they'll do it and it'll be pretty cool. Everybody should just ultimately be the best possible version of what they want to achieve. So somebody's on here saying there's barely anything there. And the thing is that to you, it may look like that, but to this patient, it really made him suffer. The thing is that you got to look at it that way. You can't look at this and think to yourself that there's barely anything there and what was he doing all this for? There was something there. It's not it is something there. And to him, he was somebody who was handsome, and until he had acne, and it reminds him of the trauma of acne, and it reminds him of the scars that he had, and it reminds him. He said he was bullied by this. He said that there's people out there that would comment on it. There were things like this that were occurring to him. So people don't really know what the story is behind some of these scars. You don't know what people suffered when they had these kind of scars and when they had acne. Nobody knows. It's okay, well, somebody else had it worse. Well, there's a lot of things that are a lot worse. There's a lot of things that are a lot worse, but it doesn't mean that what you're going through is any less. It's just, it's different. And nobody should be suffering from it. How about that? That's the way we should look at it. Just think to ourselves that nobody should be suffering like that. And we should try to work on everybody. We should try to help out whatever we can. We could do it for everything, and just nobody should have to go through it. That's what I think a lot better way of doing it. Think of it that way. Instead of thinking some people in my world too, it's I remember there's a big uproar. A bunch of doctors were so annoying. It's so obnoxious. So many doctors are so annoying sometimes. They were flipping out in these groups. They're talking about how they were they wanted to have us that they would waive the medical debt that all these medical students had incurred. And all these doctors, my generation, there's my classmates even and things like that, were so upset about it. Oh, I have to go pay for my medical school. Why don't they have to pay for my school? Who cares? Are you joking? It was so outrageous. When I was in med school, I started, it was $45,000. And then they increased it $15,000 in the middle. Between first year and second year, it raised $15,000. $15,000. And it's there's a cap on how much the government gives you with loans and things like that. There's people that were so stressed out and so upset about the whole process, they had to basically scramble to get money for this portion of things. It's a terrible thing that actually they could do to people. And it's we're going to sit there and say to people, oh, I suffered and other people have to suffer as well, or I suffered more or something like that. It's who cares? It's nobody should suffer like that. No one should. Just accept that nobody should have to go through that. It's just silly. And nobody should have to suffer from acne. No one should have to suffer from scars. It's it doesn't matter if it's mild acne or terrible, severe acne. It's just how about just get rid of it completely? How about just improving it for everybody? I think that's a way to look at it. And instead of thinking to yourself, oh, well, this is not that bad, or that person's not sometimes I see those comments. Every once in a while I look at that. I look at it sometimes. I see it and it's why is somebody bashing somebody for sharing their their concern about their scars or something like that? And people are dogpiling and saying that it's just these are mild scars and this is nothing and just get over it. Well, it's clearly affecting them, and they felt enough to talk about it, and they needed some support and help, and people don't want to do that. Danny Boring saying, do you think a lot of derms and plastic surgeons offering all of these treatments don't really know how to treat acne scars? Also super excited for my consultation with you in July. Awesome, Danny. I would say that a lot of people don't know how to treat scars. That's true. I think that's really true. I think that's more than just a desire to do it. I think that it's there's a lot involved. There's a skill set. There's a level of patience that's required. There's a level of focus that's required. You have to have a team that's really dedicated to it as well. So there's a lot involved with it, and it's not something that I would say that people are just going to be equipped to be able to do that. Eric Callahan is saying, when you say oil control for the pores in the nose, do you mean Accutane or just cleanser before the procedure? Is that so TCA acid does not mix with the oil? No, the oil basically can make those kind of scars, especially those ice pick or boxcar scars, appear more dilated. So you want to control that and normalize that more. Plus, it actually helps so that you can get a more robust collagen response when you normalize that oil. So low dose Accutane could be fine, tretinoin could be fine, but to do something to normalize that oil better, and that can end up working out really well. Do you prescribe low dose or long term or versus high dose short term isotretinoin? I typically do lower dose for a long term, but it depends on how much acne there is. If there's cystic acne, then I will do more high dose just to control that and normalize that. And I appreciate all of you guys so much. In TT, typically I don't respond to individual messages like that, but if you want to message it on here, I could be happy to do that, or schedule a consultation. But I typically do not do like anything like, well, I should just, I'll just say flat out, I don't actually, anyone that messages me on DM, typically I don't actually even look at those. My team does those ones, but at some point though, if you're interested in scheduling a consultation, just go through a virtual consultation with me on my page, or just ask me directly on over here. But I can't give actual medical advice on the patients that I haven't seen or anything like that through DMs. Appreciate you asking, but I just can't do that. And when I talk on here, it's not medical advice, it's suggestions and ideas and things of that nature. So very different. But if you're messaging me directly like that, I just can't give you, and I never even seen you. So instead, do a consultation with me, and then I'll go through each step of what I would do to help you out there. So I will. So feel free, message me in there, and I'll take care of you that way. And for people that are asking how to book, you go to drqazi.com, and if you don't see any dates, just schedule it, and then my team will call you to give you the earliest date there, and that's a way to help out there. Man, I wish there were doctors like this in Holland. I love the Netherlands. It's a really nice area, by the way, really nice. Appreciate you guys so much. Take care. We will see you again next week.